So now I'm going to do a nasotracheal suctioning. So first is I'm gonna check the patient chart and then wash my hands, and then after that, washing my hands, I'm gonna wear appropriate PPE such as wearing clean gloves, a gown if possible, or a face shield, goggles to prevent from any splashing of fluids. And then after that, we're gonna prepare or gather all the necessary things such as the sterile gloves by fully opening this one, like that. And then we also have here the lubricating jelly. We're gonna put it in here in the clean container or in a clean gauze. And then we also have a sterile water. We're gonna pour appropriate amount for the suction catheter. And then after that, we're gonna assess the patient, obtain vital signs, listen to their breath sounds, and then check the patient physically, if how they were doing, level of consciousness. And then after that, we're gonna apply oxygen, let them hyperoxygenate. And then prior to putting that one, we're gonna check the bag if it's inflated and set the appropriate flow. And then after that, we have here the regulator, suction regulator. We're gonna set the flow, make sure that it does not exceed negative 150. So when checking that one, we're gonna obstruct this until we notice the manometer, if how it reaches the pressure. So right now it reached 140. So that is good for patient's use. And then for this tubing or connector, make sure that it's not kink or obstructed. And then after that, we're gonna dispose all of this and then wear sterile gloves. So after wearing sterile gloves, we have to insert the suction catheter to the suction tubing. So when inserting that one, make sure you're gonna use your non-dominant hand by holding this one, and your dominant hand for the catheter to maintain its sterility. So prior to inserting this, you have to re-sterilize it with sterile water, and then after that, we have to lubricate it with the lubricating jelly. And then once we done, we have to remove the oxygen and then observe the patient's nose if there are any obstructions. And then when inserting it, we have to insert it gently. And then when we feel the first resistance, that means the patient it hits the vocal cord, so allow the patient to breathe in or cough. And then when it reaches to the part of the area where you want it to be, we're gonna suck it. When sucking it, this one, we will notice there will be multiple secretions going inside the suction catheter, and then you should do it for not more than 15 seconds to prevent complications such as bleeding. And then once you want to do another set of suctioning, we have to re-sterilize it again, allow the patient to hyperoxygenate also. After hyperoxygenating that one, we can do another one. So when doing multiple attempts, it should be done at least 2 to 3 times only. And then there are other situations where there will be a mucus strap being put in between this one when physicians would like to obtain specimens. And then if we're already done doing suctioning, we're gonna put the oxygen in place, and when removing this, we have to twist it carefully like that, and then remove it together with the sterile gloves and dispose it immediately to the proper waste disposal. And then we have to re-sanitize our hands, and then make sure we assess again the patient, listen to their breath sounds if there's still any crackles or wheezes, and then we have to clean this one, dispose everything, and then set this regulator back, turn it off, and then document everything. And I think that's all.